Very good morning, doctor.
Good morning, sir.
Wonderful to meet you and have this conversation to understand more deeply about prostate and issues related to prostate. In the first place, I'm very keen to understand, I'm a very non-medical man. What is prostate as a part of the body and what is its significance?
So very simple, very good question to start off with. Let me explain a bit more about the prostate. So this, as you know, sir, is the urinary system.
Okay.
And these are the kidneys.
Okay.
And the tube coming down from the kidneys is called the ureter.
Okay.
And this is the bladder.
Okay.
The bladder where urine gets collected.
Mm-hmm.
And under the bladder, there's a small gland.
Okay.
It's about the size of a lemon.
Okay.
And this is called the prostate.
I see.
The more importantly, the prostate is not present in women. It's only present in men.
I see.
And this single entity, the prostate, as you know, as I'll explain a bit later, is the cause of major concern for men after the age of 50.
I see.
So this small gland, what does it do actually? The function of the prostate gland is that it produces semen.
Okay.
And it's a part of the sex organ of the male.
Right.
And other than that, it doesn't carry a lot of function, but the potential for trouble is very high. So this is the only organ in the body, God has made it that way, that grows throughout life.
Okay.
And imagine your hands growing throughout life. That's not great, is it?
That doesn't happen. Thank God it doesn't happen. Okay.
And this is the only organ that grows throughout life.
I see.
And as it grows, and as men become less and less younger,
Right.
the potential for this organ to obstruct this passage is very high.
I see.
So that is in fact one of the major causes of trouble that the prostate causes for all men.
I see.
Above the age of 50, it starts to trouble them.
Okay. Thank you so much. I think that's very useful information for me to go further. That was a very useful beginning point information, doctor. Now, I want to understand what are the typical common prostate problems, which of course then kind of would lead me to ask you what is prostate cancer.
Absolutely. So as I told you, it's a small gland which has a potential to grow. And when does it start growing? After the age of 40. Right? After that, what happens is potentially this prostate slowly obstructs this passage that I told you about, the urethral passage.
Mm-hmm.
And because of that, you have a lot of trouble. For instance, what sort of symptoms that people can get when a passage is blocked? They'll have difficulty in passing urine.
Mm-hmm.
Yes. So let's start about problems from younger age groups, middle age and older age.
Mm-hmm.
So as people cross their 20s and come to 30s, they've got something called inflammation of the prostate. That's called prostatitis. Some infection and inflammation in the prostate. That's very common in the younger age group. Especially, we've got a lot of young people, high stressed out life, and they develop this quite often. Next, when you cross 40, 50s and 60s, the problems come because of bigger prostate. The prostate grows and causes some obstruction.
Mm-hmm.
And this is called benign hypertrophy of the prostate. It's a big prostate that's causing the trouble.
Benign hypertrophy.
Hypertrophy. Benign is not cancerous. Hypertrophy is becoming bigger and prostate.
Okay.
So finally, what can also happen is this prostate can turn cancerous.
I see.
What is cancer, by the way? What is cancer mean? Cancer is a situation where cells in the body or in a particular organ, when they start to develop, they multiply, and they finally die. And if cells forget how to die, they constantly keep multiplying. And that is very simply put how cancer develops. So if a cell continuously multiplies, it has a potential to outstrip the blood supply in one particular area and it needs more blood supply. So it goes to other situations, other organs of the body.
Mm-hmm.
So that's how cancer spreads. Starts in one area, continuously multiplies, goes to other parts of the body. Finally, the body is not able to take this constant multiplication.
Okay.
Right?
Okay.
So prostate and prostate cancer I've told you. Prostate cancer, again, is one of the most commonest entities that we're going to face in future.
I see.
Right? Because the average age of an Indian male has slowly started increasing. in terms of 20 years ago we were in the 50s, and now we're in the 60s, and in future we're going to be in the 70s and 80s.
Okay.
And as men grow less and less younger, the higher the chances that they will develop problems of the prostate and possibly prostate cancer.
I see.
Throughout the world is one of the most commonest causes of cancer and commonest causes of death.
In terms of some percentage, in terms of normative occurrence of cancer, prostate cancer would be about what percentage?
Yeah, I would say, for in India the statistics aren't that great. But if you consider the Western statistics,
Yes.
it's the number one cancer in the world at present.
So, doctor, now that you have shared the fact that prostate cancer is the number one kind of cancerous cause in the human body across the globe, tell me, is there some way in which prostate cancer can be detected slightly earlier in life?
Very, very good question. Again, for most cancers, there's not a way in which we can prevent them.
Okay.
And the best way of dealing with them is to detect them early. For that, we need to have something called a screening program. Throughout the world, there's a lot of controversy in terms of whether a screening program is good or not. Especially when you talk about our country, we don't have the resources to have a national level screening program.
Okay.
So what we can do is something called opportunistic screening. If a person walks into a hospital with some urological problems, something like that, if they have a family history, then they have a higher potential to develop this prostate cancer. And as people cross a particular age, maybe 50, we can target these populations to look at whether we can detect prostate cancer early. And how do we detect it? Very simple. There's a very simple blood test. It's called the prostate specific antigen blood test.
I see.
It's not expensive. It's available throughout India. Every nook and corner of India we can do it. And that blood test has a potential to tell us whether a person is harboring cancer or not.
I see.
And another important thing is, why should we detect this early? Any cancer, if it's in that particular organ, it can be cured. If it goes beyond the confines of that organ, for instance, prostate cancer goes beyond the prostate, it's a bit more difficult to cure. We can only control it. Same thing for kidney cancer, same thing for bladder cancer. A lot of these cancers behave like that. For instance, breast cancer is similar like that. If we don't allow it to spread beyond the confines of that organ, there's a very good chance we will cure it.
I see. That's very interesting information. Which means you kind of isolate, control, and deal with it.
Yes.
And to that extent, the ability to manage that is much better.
Much better, because the therapy can be focused to that particular organ. Imagine something throughout the body. It's very difficult for us to focus each and every spot in the body.
Right.
So if it's localized to one part, the cancer is localized in that particular organ, maybe we can do a surgical removal of that organ.
Okay.
Maybe that organ can be subjected to radiation.
Right.
So there are a lot of ways we can deal with it,
Right.
but it has to be localized for us to effectively deal with it.
I see. So as you described in your answer, I'm reminded of this terminology PSA. What is PSA, doctor? Which I believe is related to prostate treatment.
PSA stands for prostate specific antigen.
Okay, all right.
It's a blood test. So there's a series of values that we look at in the blood test, and the PSA test tells us whether there's a potential for cancer or not.
Okay.
Not all people with elevated PSAs have cancer, but all people with elevated PSA need to be examined by a urologist, and we need to find out whether there's cancer or not.
I see.
It's not just one single test. But once we know that PSA is elevated, then we do further testing. We feel the prostate. That's very important. It's called digital rectal examination.
Okay.
And through the back passage, we would feel the prostate, and it tells us whether there's any nodules or hard areas in the prostate which have a potential to have cancer.
I see.
So then there comes an MRI testing. right? So it's magnetic resonance imaging testing. It's a scan that we can do,
Right.
and that also tells us whether there's potential for cancer in the prostate. How do we confirm that a person has got prostate cancer? The way we do that is we would take biopsies from the prostate. And what is a biopsy? Biopsy is taking a small bit of tissue from the prostate, and then a pathologist looks at it under the microscope, and then we get an answer as to whether the patient has cancer or no cancer.
Right.
So these are steps that a urologist would follow if a patient walks into the clinic with some urinary symptoms. So who should we target? Obviously, people with urinary symptoms would get examined by the urologist and we do a PSA.
Right.
But also people without symptoms, but who've got a family history.
Right.
Father had prostate cancer, then double the risk of prostate cancer.
Okay.
Father and uncle have had prostate cancer, then we carry 11 times the risk of prostate cancer.
Okay.
So definite family history, above the age of 50, we need to look into it. And persons who come with lower urinary tract symptoms. What symptoms? Frequent urination, excessive urination at night, burning when they pass urine, flow is obstructed, and urine stops and starts and stops and starts, and blood in the urine. This is one important symptom that if a person has blood in the urine, we need to find out where it came from and why did it come. It could be anywhere from the urinary system, it could be from the kidneys, it could be from the bladder, from the prostate. But our goal is to make sure we know an answer as to why the blood came.
I see.
So investigations wise, we have a PSA, we have the scans, and then the symptoms would direct us as to which patient needs to be further evaluated.
I see. Okay. And then in terms of treatment for prostate cancer, would surgery be the logical kind of a first choice answer?
So in terms of treatment, let me qualify the statement a bit more. The treatment depends on the stage of the cancer. So if we have an answer after we do the biopsy as to whether the patient has cancer or not, then we have to risk stratify the patient. How do we risk stratify? Is based on what sort of cancer they have. Even in cancers, in prostate cancer, we have a good risk cancer and a very poor risk cancer as well. So good risk cancers behave indolently. They wouldn't rapidly spread, and they're very slow course and takes their own time to do the damage. But a high risk cancer would quickly get into other parts of the body and trouble the patient. So number one, what sort of cancer the patient has. Number two is what is the stage. So we also have another scan called the PSMA PET scan. It's a form of scan that tells us whether the cancer spread to other organs of the body.
Right.
And that will tell us if the cancer is localized to within the prostate or it's in different areas of the body.
So you use the radioisotope and
Yes,
then the scan
yes.
gets done.
Very good.
Having gone through that, I can tell you that. Okay.
So it's a PET scan. So it gives us an answer as to which is the stage. So if it's localized or localized to the prostate, our intention is always to cure the cancer.
Right.
If it's spread to different areas of the body, we may not be able to cure the cancer, but then we'll be able to control it and control it for decades.
I see.
So that's the potential to control it for long term is available right now. So number one is stage, grade of cancer. Number two is what sort of treatment it entails, that particular stage, that particular grade. And also important is the patient's general condition. So if somebody comes to us at the age of 80 with prostate cancer, our approach is different. We would say we want him to be alive for the next 20 years. Now what can we do to keep him alive for the next 20 years?
Okay.
Right? If somebody comes to us at the age of 40 with prostate cancer, again our approach is different. We want him to be alive for the next 60 years.
Right.
So our treatment will be a bit more aggressive.
Right.
So depending upon the stage, grade and the patient, the treatment is tailored to each particular patient.
I see. Something strikes my mind. Chennai Urology and Robotics Institution. So robotic surgery, I believe, is the big advancement in this area. Tell us something more about that, doctor.
Good question. You seem to be a repository of good questions. So number one is, what is robotic surgery? I get this a lot of times from a lot of people. Especially in Tamil, you have the movie Endiran that has come out.
Right.
So a lot of people think robotic surgery is some robot operating on the patient. It's actually a misnomer. It is a master-slave mechanism where I sit on a console, and what I do on the console happens inside the patient. So we put tiny ports in the abdomen of the patient. It's similar to laparoscopic surgery, but I would say it's 100 times more advanced than laparoscopic surgery.
Okay.
In terms of vision, we have 3-dimensional vision. The magnification is 10 times. The instruments have wristed instrumentation, which means that they're far more versatile than a human hand. So imagine, can you see a better instrument than a human hand? But believe me, a robotic instrument can move 360 degrees. It's got 7 degrees of freedom, and the wristed instrumentation, which is very tiny, even compared to our fingers, it's much more smaller. And we have a potential to operate in tiny spaces. So the goal when we do robotic surgery is to go in without any damage to the structures outside and take out only the prostate and preserve all the structures surrounding the prostate. So 20 years ago when we did prostate surgery, the goal was only one, to cure the cancer. But now the goal is not only to cure the cancer, but also to give the patient good functional and oncological outcomes. So in terms of functional outcomes, we look at sexual function of the patient. As I told you, the prostate is a sex organ. So the nerves that go to the penis are very close to the prostate. And when we operate on the prostate, the potential for erectile dysfunction is there. So when we do robotic surgery, because we can see so much better, it's magnified so well. And we've got the ability to preserve the erectile function of the patient, but at the same time cure the cancer.
I see.
So that's one of the key advantages. But not only that, the incisions are much smaller. The time taken for surgery is much lesser. The hospital stay is 24 to 48 hours. They start walking in 4 hours. They start drinking in 6 hours. The pain is far lesser. And the amount of time they spend outside the normal routine is reduced considerably. So we not only look at how quickly they get back to work, but also in our society, the relatives, the attenders, all of them are thrown out of their routine.
So much more of easing and making the curative process comfortable and faster.
Much faster.
Much faster. Now that I have some insights about the prostate cancer surgery and especially this advanced robotic surgery, I'm keen to know what typically happens post-surgery.
Right, sir. So once the patient has had surgery, and this goes for any cancer as well, there's a period called surveillance where we need to find out if the cancer is coming back or not. So when you talk about prostate cancer, we would do the PSA testing. Now, as I told you, PSA is an enzyme that's secreted by the prostate and is in the blood and can tell us whether there's cancer or not. When you take out the prostate, the PSA's value becomes very low, and it usually goes to less than 0.2 after the prostate comes out. So every 3 months for the first 2 years, every 6 months for the next 2 years, and then yearly then onwards, we would do a PSA testing to tell us whether the prostate cancer has a potential to come back or not. Right? Not only that, immediately after surgery, the patients have a little bit of discomfort in terms of urinary leakage, and within about a month to 2 months to 3 months, the entire thing settles down. Right? They will teach them an exercise called the Kegels exercise, and they need to be doing that constantly. It's not a difficult thing to do. It takes about 30 to 35 minutes per day, and a lot of people get to do it very quickly. And there's also a penile rehabilitation protocol. So we'll give that to the patients to improve their sexual function and so on. So not only prostate surgery, but even if they've had other treatments, for instance, radiation or hormone treatment, the prostate's a cancer that grows because of hormones. The testosterone from the testicles, that makes the cancer grow. So if a patient has got cancer that's spread to various parts of the body, then we just do hormone treatment for the patient and keep the testosterone under control. And this can help the cancer be under control for several years. All of this is followed by the PSA test. So the PSA test is for prostate a single stop shop for most of our needs. So we do the PSA is very low after cancer, we're happy. And the PSA test, if it slowly starts rising up, then we need to be looking out for what's going to happen and so on and so forth. So what to expect after surgery? An initial period of a month to 2 months where they will recover from all of the troubles from prostate surgery, and then they will be expected to regularly follow up with the urologist to do the surveillance protocol, so that we need to find out whether it comes back or not.
Okay. So I can see that there are very clearly milestones and kind of pathways by which post-surgery there is some tracking and keeping updated about the patient's condition and ensuring that issues that can come after, let's say, a prostate cancer surgery can be well monitored and well controlled. I think that's very good information. Now, which brings me to this important point. Doctor, tell me some more about that. The public would love to know a lot more about the Indian Prostate Cancer Foundation.
That's my passion, the Indian Prostate Cancer Foundation. So why did we start the Indian Prostate Cancer Foundation? Very simple. When I came back from the US and started practicing in India, what I found, the difference between what was happening here in our country versus what was happening in the Western world was there's a stark difference. If 100 people walked into my clinic in the Western world, or the US, 80% of those would be in a curable state.
I see.
And if 100 people walked into our clinic now in India, 80% are in a stage where the cancer is spread beyond the confines of the prostate.
Don't tell me.
Yes. So what is the difference? The same doctors, the same technology. We have robotic surgery here, we have irradiation, you name it, we have it here. What is the difference between them and us that gives us this sort of changing patterns of disease? It's very simple. What I realized is the lack of awareness. Lack of awareness as to what the prostate is. Lack of awareness as to what the PSA test is. And that really hurt us in terms of whether can we do anything to change this scenario in India.
Okay.
And that was one of the reasons we started this. The Indian Prostate Cancer Foundation's very simple goal: to prevent needless suffering because of prostate cancer. I say needless because it is needless. You can potentially prevent all of that. You can potentially detect it at an earlier stage. You can potentially cure it. So instead of that, we've got a majority of our patients in a non-curable state, and that is what we hope to change. Number one is a lot of awareness programs, a lot of health education, not only to patients, to doctors, to general public. And then we're also teaching what we are doing here in the Chennai Urology and Robotic Institute in terms of health education, in terms of huge awareness programs. And it's not only for the other doctors who come here to learn, but the patients who've had prostate cancer, who've been diagnosed with prostate cancer, who are going through the rehabilitation after prostate cancer. We're running a support group from under the aegis of the Indian Prostate Cancer Foundation called the Prostate Cancer Support Group. So people who are suffering from prostate cancer, we've probably done 1,000 patients with prostate cancer surgery who've undergone robotic surgery. And a substantial portion of them come to the meetings we conduct every month to share their experiences. It's something where I can tell patients how to deal with prostate cancer, but it's far better if it comes from another patient who's undergone prostate cancer.
True.
So if a patient tells another patient, they're all survivors. If a survivor tells another survivor, this is what I went through, this is how I overcame it, it always comes across better. The receptiveness of the patient who has prostate trouble is far better when another person who's undergone it tells them.
Right.
So that's what we're trying to achieve. An environment where people share their experiences, helping people who've just been diagnosed, helping people who have some sort of trouble due to prostate.
Right.
That's one of the main goals of the Indian Prostate Cancer Foundation.
I see. And is it spread across the country? I know that it is headquartered here.
Yeah.
But is it spread across the different parts of India?
Right. We started about 3 years ago.
Okay.
And a year ago we started the Chennai Urology and Robotic Institute.
Right.
Now the Indian Prostate Cancer Foundation has a home, and slowly it's going to spread its wings all over the country.
Right.
So we've also got people interested in other parts of Tamil Nadu and Kerala.
Right.
So we're starting out with sending our team members out there to start separate units all around the country.
Okay.
So that's one of the main, again, a patient is a patient anywhere in India.
Right.
And the foundation's goal is to help any prostate cancer patient. And however best we can do it, whether we can start small units outside different parts of the country, or we can liaise with them from here.
Right.
So we're doing every bit possible. I think the support group is an online group, as well as it's got a physical place here in the hospital. So anybody who wants to communicate with the members of the support group is more than welcome to.
Okay.
So that's how we're organizing it, structuring it. Hopefully it will spread its wings much further.
Doctor, I have no words to express my thanks for this wonderful session that I've had with you. So much of in-depth clarification about prostate related issues, more valuable information about the prostate cancer itself, and the very positive indicators of the robotic surgery, and then this whole initiative in terms of social concern that you talked about, the Indian Prostate Cancer Foundation. I'm really speechless right now, and I think this information that you have shared, which is knowledge for me, first time knowledge, will be very useful to many hundreds of others, and I hope that people watch this video, get these insights, and if required, get in touch with you, or certainly encourage the activities of the Indian Prostate Cancer Foundation. Wonderful, great education and great service. I wish you all the best, doctor.
I must thank you, a person of your stature, coming here to take part in this awareness program. It really is our good fortune. Thank you so much.
In Tamil, I say that Aram Saranda Samudayam, a society which is based on Dharma and principle centeredness, is the greatest society. I think in terms of, therefore, the sense of service with which you are bringing in really fits into the concept of Aram Saranda Samudayam. God bless, all the very best.
Thank you so much.
Thank you so much.